sawbone, and this is how the plate basically sits. Now if you look at it, this plate is meant to be sitting on the femur quite high. This is far away from the condylar area here again. This would be rather where the patient's medial epicondyle would be. So the plate sits flush like this, okay, and this is quite high. The plane of the osteotomy typically is oriented somewhat like this. So it begins where the distal femoral geometry starts changing from the metadiaphysis to the epiphyseal area, and this is how the plane of the osteotomy goes, okay, and the hinge basically is at a point which is just distal to where the again the flare of the condyle starts to appear over here. So when we place the plate correctly in line with the osteotomy plane here, and the osteotomy plane again is important because if we see this angle which it forms with the plate, this is actually 90 degrees on both sides. This is 90 here and 90 here, correct. So when the plate is positioned as such, you see this will be slightly more anterior like this, and when adequately positioned, this sits almost perfectly with the anatomy of the patient. There might be some offset because of individual variations, but typically this completely sits flush to the distal femur. Now this is the variable angle screw. This is the variable angle screw, which if not placed correctly, the screw might sometimes get into the notch area here, and therefore it is very important to change the orientation of this screw. And all these screw trajectories are such that they will all be appearing proximal to the notch area here. So we will not be disturbing any intra-articular structures in that manner. So this is sort of how the plate sits. We will see when we are performing the osteotomy in the cadaver itself as to how to place this correctly.